Hello. Today, as part of the World Metropolitan Municipalities Day, we are organizing this event as the Marmara Municipalities Union and Argüden Governance Academy. We are going to be exchanging experience about a problem we shared as the entire world. And through this experience sharing, we believe that our power to struggle with such situations will increase. And with the COVID-19 pandemic, what were the situations that arise for the metropolitan municipalities will be the question asked. And Mr. Cemil and will have an opening speech as the Secretary General of the Marmara Municipalities Union. And then I will be moderating a panel where the Associate Professor Tahir Büyükakın as the Mayor of the Kocaeli Metropolitan Municipality and also the Mayor of the Marmara Municipalities Union. And we will have Kadir Albayrak, Tekirdağ Metropolitan Municipality Mayor, and Professor Önder Ergönül from Koç University Infectious Diseases Research Center will be sharing their opinions with us. And I'll leave the floor to Mr. Cemil now for his opening speech. Thank you very much. Good morning. I cordially greet you all. Now, of course, our Kocaeli Metropolitan Municipality Mayor, who is also the mayor of the Marmara Municipalities Union, and Kadir Albayrak, the Tekirdağ Metropolitan Municipality Mayor, is here. So it's kind of awkward that I am doing the opening speech, but I guess it was technically required. Now, as you know, Metropolis is a network that has members all across the world from the metropolitan cities. And Argüden Governance Academy is one of our very important stakeholders, and they have had many events organized in the past years. One of the many things that COVID-19 taught us is about the central government, local government, health sector, finance sector working together. We saw the importance of this cooperation, and Argüden Governance Academy has experienced this governance throughout this period. And we are actually quite shying out on inviting our mayors to events like this because they have a very busy schedule. They are spending 24 hours of the day trying to touch the lives of people. And in this event, I would like to thank all the mayors that have accepted our invitation. And we have started to work on the inventory of the municipalities as well, and soon we will be able to present this to some researchers as well. And I would like to end my words here, and I would like to thank our mayors, Argüden Academy, and our professor very much for being with us. Yes, and by the way, we have two language options. One is English and one is Korean. The Korean one is actually Turkish. So you will be able to listen to simultaneous interpreting through these channels. And if we have any foreign guests, they can listen to the English interpretation through the English option. And now I'd like to leave the floor to Mr. Metin, and then we'll start with our panel. Good morning. Welcome, everyone. On behalf of Argüden Governance Academy, I would like to welcome you all. And also with the competency I am getting of being a medical doctor, I would like to talk for about 2-3 minutes. Now, there is an issue we're dealing with, and the dimension of this issue is only 88 nanometers, and a nanometer is 1 in a million from a meter. So we are talking about a being that is so tiny, but that is impacting the entire world. So towards the end of last year, experts on the issue were the only ones aware of what the coronavirus is. But now the whole world knows this new member of the family, SARS-CoV-2 virus, and it has created a pandemic across the world. It's a very simple RNA virus that has impacted so many people. So let's go a few months back. And how did this disaster begin? In December 2019, in the Wuhan district of China, there was an atypical pneumonia case, 2 cases with 2 patients. And when doctors looked into this, they discovered a new coronavirus. And the Wuhan Institute discovered this RNA virus, which is from the same family that infected 8,100 people and killed 800 people during 2002 and 2003. And this was a new version of it. And the natural source of this virus was bats, but then it was transmitted from human beings to human beings as well. And it was quite a it was a virus that was having transmission from person to person, and we believe that it existed months before it was discovered. And coronaviruses, I'm sure Professor Önder will want to go into the details, but roughly speaking, they are viruses that create a contagion, and it is not very easy to prevent them and deal with them. They have created contagious diseases in the past as well. And both during the last decade at the World Economic Forum and also the Bill Gates TED Talk, for example, have always talked about the potential threat this was creating. So thought leaders sent out warnings to be prepared for pandemics, but this issue we have been experiencing for 6 to 9 months is actually quite striking in the sense that it shows us we were not really prepared. So the COVID-19 disease created by this new coronavirus has led to the death of more than 1 million people. And according to CDC, the world's greatest economic power, the USA, when we look at their statistics, after cardiac diseases and other diseases, coronavirus is the third in terms of creating fatalities. And no environment, no geographical region is entirely protected, entirely safe. We can't escape from this. The virus can infect anyone at any age. It doesn't differ between races. And the main transmission route is air. It's through droplets mostly rather than surfaces. And it is not very easy to discover or identify who is carrying the virus. A lot of people are carrying this virus without showing any symptoms like fever. And there probably isn't going to be a seasonality. It's not going to act like the flu virus. Using masks is critical because through the usage of masks, almost everyone, as they are talking, as they are coughing, are able to transmit this virus. But the use of masks prevents this from happening. And when people wear masks, they are able to protect their own mucosas. So what did we witness throughout this process? We saw the importance of scientific guidance. Policymakers that took decisions with the guidance of science were able to better lead their countries. They took accurate decisions. But leaders who thought of science as an enemy, who denied the use of masks, and who looked down on this virus, created harm, and it led to further deaths. And I would like to underline one more issue. It's not just about COVID-19. Because the health system was damaged, this virus led to the death of people with many other diseases as well. And there are a lot of figures coming from the West about the harm created on cancer patients. But basically, let me say this, in the USA, there is information received that cancer-related deaths will increase, and in the UK there will be plus 18,000 deaths in cancer patients, and the cancer diagnosis rates have dropped drastically. So we can say that deaths caused by other diseases is also racing with the COVID-19 related deaths. So will this nightmare come to an end? Now, science people are saying recently that COVID and SARS-CoV viruses will never be entirely eliminated. We are going to have to learn with them. But the pandemic will come to an end, either a sufficient amount of people will be vaccinated, or with the increase in the mortality rate, and also with the people who have experienced the disease and who have recovered, the virus will not be as impactful. But the problem is not the SARS-CoV-2 virus, really. We are having these meetings so we can be better prepared for future potential viruses, because in the future, again, we will be facing such contagious diseases. We discovered the importance of public health in places like the US and Europe. In countries where therapeutic health systems are very developed, still there were many problems. We had to access the homes of people. Health professionals became very important. The pharmaceutical distribution network became very important. And when you have a lockdown, the way you need to help the people who are locked down in their homes, retirement homes, dormitories, people with disabilities needed to be another area of focus, and public literacy was discovered to be very important, and information that is backed with scientific data is very important, rather than rumors going around. And when we look at all of this, of course, local governments become very important. Now, this disaster initially was a health problem, it still is, but it's also a social, economical, political, and security related problem. So that's why local governments should be involved, and they have a huge responsibility as part of this. And let's have a look at our experiences, and we need to look at what we can do better in the long term. So I would like to thank you all once again for being here with us, and I wish you all a good meeting. Thank you.
Thank you, Metin Bey. Now we will proceed with the panel. Firstly, we will have three distinguished panelists. I would like to briefly introduce them. The first panelist is Associate Professor Dr. Tahir Büyükakın. He is Mayor of Kocaeli Metropolitan City. He is also presiding over the Marmara Municipalities Union. The second distinguished speaker is Kadir Albayrak. He is Mayor of the Tekirdağ Metropolitan City. Önder Ergönül. I'd like to draw a general framework. COVID-19 has impacted the entire world. It led to a crisis. Well, actually, the issue of pandemic has been discussed for many years. In 2019, people talked about an influenza pandemic at the WHO, and WHO recommended countries to get prepared for an influenza pandemic. But work in this area slowed down. People there, we don't know when the pandemic will come, so allocating sources is not a priority. And many institutions all over the world, they are not prepared for a pandemic because they haven't attached importance to it and haven't allocated enough resources to combat it. So today we'll talk about the governance of this issue. What is governance? Well, it's about taking the right decision, ensuring participation of stakeholders, and to make evaluations, assessments together, to decide based on data. And the owners of data need to share this data. And public information is also an important aspect of this process, so as for it to be managed correctly. So a serious effort of coordination is needed. So when we look back at the last 6 months, we've seen that municipalities have fought a lot, struggled a lot. It was not an easy period, an easy time. As citizens, well, we see the municipality as first contact points. When you look at the political system of a country, the municipalities, they are the first point of contact for citizens because they receive many services from municipalities. They apply to municipalities for help, social aid, and assistance. In the COVID-19 period, what we've seen is that there's more social assistance demand of citizens from municipalities due to economic problems of our country and the own resources of municipalities being reduced, going down. Municipalities had difficulties managing this process, but socially speaking, municipalities have gone on supporting their citizens. Many important lessons were drawn in this period, and we'll hear those first-handedly. The mayors will talk about their experience, and Önder will talk about the public health process, how everything evolved, and how we can ready ourselves more. And I would like to start with Associate Professor Tahir Büyükakın. Looking back at in hindsight, looking back at the last 6 months, municipalities are touching people's lives directly, and they're providing social support structures, and they need to coordinate their efforts with many other institutions, with the central government, of course, with the NGOs and the private sector and other public institutions and even international institutions. So looking at it from this angle, how would you assess the last 6 months? Where is room for improvement, in your opinion? What do you think? Well, yes, distinguished moderator, thank you very much. I would like to salute you all and extend my deepest regards to each and every one of you. I hope it will be a beneficial meeting for everyone. So there's a size issue. We are talking about metropolitan cities, but when we say municipalities, there are 51 provincial municipalities, 30 metropolitan city municipalities in Turkey, and more than 900 sub-province or district municipalities. And there are townships, smaller municipalities. So it's not a uniform organization, as you know. Kadir Bey, Tekirdağ municipality and Kocaeli municipalities, they're each other's replica, they're different. Konya metropolitan city is different. They're in charge of 40,000 square meters. Kocaeli is in charge of 305,000 square meters. So there's a size issue. There's a size difference. There are differences in staff. There's difference in the surface area they're covering and the population they're serving. And the geographical structures are different. So instead of instead of generalizing municipalities, we have to start with a conceptual framework. It's a crisis management issue, in fact, independent from the type of crisis. Even if it's an economic crisis, even if it's a health-related crisis, we are faced with three issues. One of them is predictability. So when an economic crisis will occur, we're trying to predict that. We're trying to make predictions when an economic crisis will happen, and there are mathematical models to do that, to get ready. We shouldn't forget that while envisaging and predicting pandemic risks is not possible, this is the area of healthcare professionals, not of municipalities. Okay, let's say we've predicted a crisis. Sometime it will happen. Well, we guessed it would come to Turkey. We had established a healthcare team, but it arrived in March. The first case was identified in March at least. And then we have to manage the crisis and then take preventative measures. And to be able to prevent it, let's say you've done everything you could, but then people are affected, and then they're victims, and we need to rehabilitate those victims and then heal the wounds and adopt measure packages, including several measures, etc. So the well, it's about referral and then administration. Referral and administration is a military term in Turkish. So you have your own resources and capabilities, and you're limited to these resources and capabilities. You have a certain amount of people, human capital, and they have their capabilities. And then you have resources. Other institutions have other resources. You have to predict, you have to prevent, and you have to manage within those means. So looking at the problems that we've experienced, we can put them into categories. In fact, to structure my speech, I'd like to put them into categories. So everyone who had issues with procurement, supply of materials. There was a scarcity of materials, of goods. And, well, everyone tried to procure the same goods at the same time, and a state of emergency was declared. People ran to the supermarkets because they were concerned they wouldn't find certain items on the shelves. So the shelves, they were emptied. And then, so this is a management of supply of goods. That was an issue. And then, of course, municipalities, they are responsible for these to a certain degree, but there's not much that municipalities can do in that regard. Then essential needs, meeting essential needs. For example, you shut down the barber's shops. What will happen to those people? Where will people go to cut their hair? I mean, the emergency action plans, we have emergency action plans, for example, to manage people during an earthquake. But for pandemics, we need to have emergency action plans as well. And who is responsible for what, how to organize what, who will supply what. So a sharing responsibilities will have to take place beforehand. And then preparing capacities, that's another issue. We've seen it in buses. Intercity buses, they have 27 seats, or intercity buses, they're 7 meters long. They can carry passengers, double the amount of passengers that are seated. So this is the normal capacity. If you cut the passengers in half, and everyone needs to be seated and leave an empty seat next to one another, well, no one can stand in a bus. When you say that, tell that, the buses will no longer suffice. And there are many such examples, but it's a capacity problem. So you have to keep that in mind. Capacity may be scarce, may be insufficient during a crisis. That was an important lesson. The other one is management of human resources. Well, from the municipalities' point of view, there are people at risk. You know, I mean, the people who are sick, who are at risk of an attack, so they should not go to work. We have 11,000 staff in all our companies, including state waterworks. So 1,400 people were not supposed to come to work. So you're losing human resources in a way during that time. And in our teams, for example, when we had a corona case, the other people who work in the same environment, they were quarantined. So the whole team is no longer there, and you have trouble managing that team. So they work in rotation. You separate people in groups, and then when something happens in that group, there's a corona case, let's say, the entire team is shutting down. Well, on the other hand, coordination was an issue. So we were not bad when it came to coordination. We had pandemic boards in provinces headed by the governors of the province, and they managed things well, and they took decisions very quickly. In Kocaeli, for example, we collaborated with the university, and we had quantitative forecast models to calculate the contact cases. We got the cases from other countries. We tried to predict what will happen in the future here. We prepared contingency plans. And so the case was identified in March in Kocaeli. In mid-June, we thought it will slow down. The level of cases would be 7,000. We forecast this mid-March. So with the health sciences department of university and statisticians of the university, we developed prediction and models. That's critical because it helps you seeing the what will happen in the future. And well, and then intubated patients in intensive care units. Our capacity was 420, I think, at the time. So we should not exceed that capacity. We knew that. So we focused on that and took measures accordingly. And in the sense, prediction models, developing prediction models with other institutions and coordinating our work with other institutions is very critical. And then public information, yes, timely information and correct information, accurate information is critical. So if you inform people late, and if you don't inform them at all, people will listen to rumors and they will panic. They will spread lies and rumors. And well, in fact, we are talking about a pandemic now, but then there's something called infodemic. So maybe you can term it as infodemic. So unless you provide accurate information, and if you share wrongful information with people, that will cause trouble. So management of information is also very critical. So I mean, how many masks did we deploy? How many schools did we disinfect? I mean, I will not go into details, but if you want to hear this information, I can share it with you. I think it's enough for now. I think there will be a second round, right? Yes, there will be a second round. Mayor Tahir, thank you very much. That was very important. Public transport, mass transit, it's important in terms of spreading the disease. So, and of course, was challenging to organize public transport during the COVID times. But maybe we can talk about other developments. People started to use mass transit less. They started to use their own cars to drive to work. That happened in Turkey as well. Yes, I mean, the health director, he is keeping statistics on the sources of transmission, and based on modeling and data analysis. So 50% of transmission happens at home. Buses are number 3 on that list. So people, they're exposed to the virus at home more. This is a field observation. This is what I wanted to tell you.
Thank you very much. I would like to address the same question to you, Mayor Kadir. Can you share the experience you've had in the past 6 months? what kind of improvement areas did you see in terms of coordination? What were the things that were required, and what could you do in terms of preparation? If you could tell us, please. Hello, esteemed Kocaeli Metropolitan Municipality Mayor, distinguished panelists. I would like to cordially greet you all. Now, throughout the 6 months, we had quite busy days. My counterpart also talked about it. We experienced almost the same things, but of course, Tekirdağ has a specialty. It is 1 hour away from Istanbul, which carries 65% of the pandemic, and it is also only 1 hour away from the European border. So at such a location, we had quite busy days. And as soon as the pandemic started across the world, we created a crisis desk at the health department of our municipality, and hand in hand with the governorate, we worked on this issue, and I attended all meetings. And our esteemed governor, we have 11 district municipalities, and all of the health institutions worked selflessly, and we tried to support them as much as we could. And when we look at the results we have achieved, our esteemed Health Minister Fahrettin Koca also specifically talks about Tekirdağ with special recognition, so that made us very happy as well. But there are a lot of learnings to be made here. Now, as it is the case in the entire world, I believe this pandemic brings threats and opportunities to all of us at the same time, because the humankind have learned how important it is to live together, how life becomes meaningless when the other doesn't exist. So I believe nothing will ever be the same again. And also, in terms of the fight against this pandemic, we learned that acting together, managing together, having governance together is very important. So it once again underlined the importance of the phenomenon of governance. And there was a strong coordination and collaboration between all of our municipalities. And I have been the mayor of the Tekirdağ municipality for 7 years, and we said administration should be based on standards. And we had said this before this as well. We also had a food security system that was further enhanced, and we worked on corporate excellence activities. And I am talking about all this because throughout this process, we had the opportunity to better understand the needs of citizens and better meet their demands. So for that reason, we worked on activities around this area, and we are now also at the certification stage for citizenship activities. So civil society, central government, citizens, and the local governments need to be in contact. And we have the 153 hotline, hotline 153, where citizens can call for complaints. And the municipality had great coordination with all of its departments, and we basically focused on 3 pillars. First of all, we worked on activities to prevent transmission. 2, we provided support for economical and social life. And 3, we worked on collaboration with other institutions. And in this context, together with all local governments and with civil society institutions, we carried out our activities. And we also worked very closely with the trade associations, and we worked and acted simultaneously with all of the institutions, and I attended all the meetings conducted by the Provincial Health Directorate. And in the meetings we had every day, I always emphasized to my team that collaboration was very important. And as I said, we focused on 3 pillars that I already mentioned, and we have a little booklet here. We have many numbers here. I won't go into the details. It's just like all the other local governments and metropolitan municipalities. We all provided as much support as we possibly could. And at the point we have reached, currently, the situation in Tekirdağ is quite good, but especially after June, there have been some developments, and Tekirdağ ranks very high in terms of receiving migration. We get 25,000 new people coming into the city every year, and basically the local population is 15%. The population that came through migration is 85%. And we have a lot of people coming in from the districts around. So that created a challenge for us because people are so used to visiting each other from close district. And Marmara Ereğli, for example, has a winter population which is very low, and it increases so much after June. It's similar in Şarköy. So that kind of created a challenge for our activities, people coming for the summer. And there's one more thing I'd like to say. First of all, we need to be coordinated among ourselves, and then we need to focus on the governance-based model that we have always adopted. And this pandemic has taught us that we need to be prepared for collaboration, and it has created opportunities in terms of making better use of digital tools as well. So that's all I'd like to say for now until the second round. Thank you. Thank you very much, Mr. Kadir Albayrak. Now I would like to leave the floor to you, Professor Önder Ergönül. Now, when we look at the 6-month process that we have gone through, in terms of public health, what we witness in terms of the local government activities, can you tell us about that? How were the activities until now? Where can we see opportunity areas? As an expert opinion, would like to hear your views. Yes, thank you very much. Distinguished speakers, distinguished organizers, thank you very much. And also, I would like to thank Professor Metin for his invitation. I listened to the previous speakers as well. We heard very valuable information. I'd like to thank our mayors as well. Now, I shared an article in the chat box. We have a new article about the difference of case fatality rates among different countries. This is going to be very important in the future. This was an article that we wrote together with our international colleagues led by the Koç University. And by the way, we established the Koç University Infectious Diseases Research Center throughout this period, and I'm the director of this center. And our goal is to have institutes like Robert Koch and Pasteur Institute. So we want to turn into such an institution as well. So in every country or in each municipality, for example, we see that the response was based on their previous preparations, basically. And Italy, Spain, UK, USA, for example, these are countries that are pioneering in terms of science, but there were huge mortality rates. For example, the UK, I mean, even if we put Italy and Spain to the side, UK and the USA are significantly pioneering in all areas of science. And our question was, why did they have such a high case fatality rate? Now, when we look at Turkey, for example, this rate, the CFR rate, is quite low. I mean, I'm not going to go into the details of whether the data is accurate or not. Even if the data is not accurate, we also have predictions about this. Still, the CFR is quite low in Turkey, the case fatality rate. And when we look at the details of the difference between these rates across the countries, we can better understand what can be done better at local governments. Now, of course, first of all, it's about the public health system. So how can we measure this? Well, the bed capacities, the ICU capacities, and of course, the work of the health professionals, the selfless, the volunteering work of the health professionals. Now, in terms of bed capacity, we never had a situation as bad as Spain or Italy or the UK. We didn't have people waiting by the doors of hospitals or dying outside the ICUs. So it is kind of about the health system. When you look at the USA, for example, their system is basically saying people without money can die. People who don't have money find it very challenging to receive healthcare services. And also the USA always brags about its cosmopolitan doctor potential, because they say the best brains in the world go there. But when you look at the health professionals and doctors in Turkey pursuing the historical trail of Turkey, worked very selflessly. I mean, sometimes we are having a very narrow vision within our own country. When you look at it from the bigger picture, from the world perspective, you better understand the situation in your country as well. We must understand that the attitude of the doctors of the USA were very different compared to the selfless attitude of our doctors. Another issue, of course, was the age of the population. Now, Italy had a very high rate of elderly population, and there were a lot of people who passed away in their homes, and we worked closely with our Italian colleagues at the time. We are still in close contact, and that is something that needs to be taken into account. This is also an area where lessons can be learned. The elderly population needs special care. And in terms of our population structure, yes, we do have retirement homes, but mostly, compared to the West, we are a society, a culture that really attaches value to our elderly. And mostly elderly citizens are taken care of by their own families in the same homes. And now, leaving aside the age factor and the potential of the healthcare system, the bed capacities and things, another critical impact came from obesity. Now, obesity is quite widespread in Turkey. We can't say it doesn't exist. 20 years ago, we could say obesity didn't exist, and we could actually brag about it. And we didn't have numbers, but we were saying, you know, we have great fruits and vegetables, and people go to the marketplace, they get their vegetables and fruits for very affordable prices. So thankfully, we're not like the USA, we used to say. But now we can't say that anymore. That's what the figures are telling us. And Turkey ranks second after the USA across the world in terms of obesity. So this was an important gap we had, and we see that the fatality rate is much higher with obese patients, because obesity invites other diseases as well, like high blood pressure and diabetes and things. So when we talk about population distribution, for example, countries with a more scattered population have less impact. They have lower case fatality rates. For example, New Zealand or Iceland. Now, they're saying, yes, our fatality rate is low because we are very successful. But actually, the virus hits the big metropolitan cities of big countries. And we have our metropolitan mayors here with us today. For example, in Turkey, it really struck Istanbul at the very beginning in the first 6 months. In the USA, it was New York. And then it was another population dense area, Miami, Florida, for example. So these were the places that were hit by the virus first. But when you look at the USA, the countryside, the rural areas weren't really hit by the virus. So moving from this point, we can say that the virus basically hit some of our bad habits, or we paid for those bad habits. One is obesity, really. Obesity really needs to be reduced, and the chronic diseases that come with it need to be reduced. And also unplanned urbanization and intense urbanization. So basically cities, very population dense cities with unplanned development were the areas that had the highest fatality rates. And mostly the big cities of developed capitalist countries, and these are not simple countries, simple cities, Madrid, New York, London, Amsterdam, for example. But in the second phase, after the 6th month, basically, India, Brazil, those countries were also hit by the virus, again in population dense areas with unplanned urbanization. So there are a lot of lessons to be learned from here, but the humankind can forget about all of this. And the previous pandemic is not really far. It's only 10 years ago, the swine flu pandemic in 2009 and 2010. And there were a lot of funds opened after this by the EU and the USA. And supposedly preparation activities were done as part of these funds. And we were part of some of them and not part of others. But it's basically like the earthquake situation. When there is an incident, people come to their senses and it's too late. I hope that doesn't happen, but one of the basic learnings is that urbanization should really be emphasized. It's just like the earthquake issue again, unplanned urbanization and population dense areas are very hard to control. So instead, scattering the population is very important as a general precaution. And also age. For our elderly, our sociocultural structure protected us, but still we need to be careful about that and make sure the necessary investments are being done. And thirdly, to go into the detail of urbanization, public transport, for example. I use public transport in Istanbul for commuting, and at the beginning, public transport was very good. I mean, we could be proud of it. The subway, Marmara, Metrobus, all of them were really good. But of course, after one point, it was very hard to control. And currently, it is basically left to the intentions of people. I mean, some are saying, let's not take public transport as much, but we don't basically have a counting mechanism of how many people go on to the public transport vehicles. So there are some things that can be controlled and some that can't be. And public transport was one of the most visible systems that was accused the most in Turkey. Now, I agree with one data. Sometimes the things that are visible may not be the actual cause. I mean, public transport is easily accused, or having health professionals that are infected makes it look like working at a hospital creates an impact. But it's actually 60-70% of our health professionals were infected in their own neighborhoods, in their own homes. We have data on this. And we need to be able to learn to talk based on our own data. So we need to work with big data here, and we are prepared for this. I'm talking on behalf of my research center. We are not only trying to create this virus and work on medication. we are also trying to acquire data and use this data positively. I mean, it is something that is very much feared, like Big Brother is watching us, we don't want to give our data, but actually when used ethically with moral values, it can be a great resource. And working together with other universities and their research boards, the data can be managed. We are open to such collaborations. Maybe this might be enough for the first round.
Well, it was a health crisis. And you're right. European universities and Indian studies. They show that where there's a dense population, the spread of the disease accelerates. Well, they were better off at first, but then it started spreading there as well. So, in fact, I would like to give you with two pieces of information. With Maltepe and Sultanbeyli Municipality, we're working on a crisis model, which will be based on data. It will have a theoretical infrastructure, of course, but municipalities, they will involve their own citizens, their own organizations and public bodies. They collected data 360 degrees, actually, and the data was used to shape the model. It is in a final phase. I think it will be completed in a month's time. And we will share the data with you and discuss it all together. This will be a model based on our first-hand experience. And distinguished mayors and Önder Bey would like to obtain your view on this as well. At least we will know how to act during crisis and respond more effectively to future crisis at the end of the day. So, Mr. Büyükakın, I'd like to turn towards you. You look at all of your experience. What would you say you could have planned better in hindsight? Well, thank you, distinguished moderator, and I would like to thank the other speakers for their contributions. Well, we need to mention several points firstly. Well, outbreaks, they're part of real life. And as an academician, when I look at the matter from the historical point of view, we needn't be that pessimistic. I mean, we shouldn't be pessimistic. And I mean, during the plague, for example, back then, the people thought it will never become better. And during the SARS crisis, they had the same opinion and the same thoughts. But nothing goes poorly until the end of times. You have to be more optimistic. And I don't think this pandemic will last long. It's just an estimate. It's not based on data. But looking at occurrences in the past, nothing becomes worse. It becomes better. So I'm in favor of optimism. So while managing the psychology of people, I think this will strengthen our agenda, and this has to be an item on our agenda because people are panicking, and there are things that have not been discussed so far. For example, the physician, he knows better, but people they're obsessed with becoming ill. Like the earthquake in 1999, people there became pathologically ill. They couldn't sleep at their homes after the earthquake. It's still relevant. I mean, people, they can't sleep at night. They wait until the sun rises in the morning and then go to sleep. So people, they are obsessed with diseases and becoming ill, that will be a major psychological issue. Managing the psychology of people, it's important to prevent spreading panic. And so psychosocial management, that's an important issue. And I mean, estimates were made, forecasts were made, and they were optimistic or pessimistic. I will not interpret that, comment on that, but dense cities and non-dense cities. I mean, first we said women do not catch the disease, or they catch it to a lesser extent. This is a statistical abnormality because of lack of data. That's not true. Men they go out more. That's why they get sick, they said. And it's not only, it doesn't happen in the metropolis only. It spreads in the surroundings. In rural areas we see the disease. That's what the statistics show us. And only because there's less interaction in rural areas, it spreads later. I mean, the pandemic risk is lower, yes, in rural areas. But when you look at when cases and you come into contact with a case, because there are less healthcare facilities, the fatality rates they increase in rural areas. So you have to look at the data. What kind of data are you analyzing? You have to have a sound causality, cause and effect relationship. I mean, because there are many physicians, many people die. So you can't derive that, come to that conclusion. We have the least amount of cases were in Kandır'a in our city, because they have 50,000 people live there. The surface area is large, and that people live in a scattered fashion. But in Darıca, where 4 times people live, there are more cases. This is what is expected anyway. But when we have the accurate averages in due time, I don't think there will be a statistically significant difference at the end of the day. So we have to cautiously evaluate the data. And when it comes to modeling, yes, we're ready to help you out with modeling, because there's a huge experience and accumulation of data in Kocaeli and the university. And the Ministry of Health is conducting studies, for example, the HAS codes of buses. I mean, they are trying to set up a system for buses in cities which use carts in public transport. Kocaeli is part of that study. There's a software program. We have a card, a bus card, Kent card, and you have a validator in the bus which reads your card. And the HES code of your car has to be identified, recognized by the validator. And so, cases will be detected in such a way, in that way. So ICT technologies, we will make more use of those going forward. That's an opportunity for us, and we all and this will help us in managing such processes, support the decision-making process and the crisis management. So we need to collaborate more with universities when it comes to ICTs technologies as well. So in that sense, public awareness raising is important. So we have city theaters, and we were supported by the actors of the theater to draw the attention of people. They helped us, and then they, healthcare people dressed as healthcare officials, they went out to the street and started warning people where you're wearing the mask wrongly, you have to put it on like this. And then the screens, public screens are used. The mayor asked people to wear their masks correctly, and why aren't you wearing a mask? So we had more open air cinema activities, for example. We had more open air activities. We need those activities more. And when you plan the city, you have to have more open air spaces. And so we had more open air activities, focus group activities for children, for the elderly, older than 65 years. We had focal group activities organized by municipalities, and then social aid and support and assistance. That's important in these times as well. But I mentioned that there was a capacity problem, and the means available to us, they are available in ordinary times, not in extraordinary times. So even if you utilize all of the staff of the municipality, if there's state of emergency, you can't send them packages of food to everyone. You can't send everyone a package of food. So even if you have those, there's lack of staff. So NGOs, they become more important. And NGOs, there's this neighborhood volunteers for earthquakes. We need to have a similar structuring or organization for a pandemic. Action plans need to be prepared including NGOs and volunteers in neighborhoods need to be organized within that action plan. So we have to talk about scales. That's a scale issue. You should not mix this up because we talk about metropolitan cities. Kocaeli is a metropolitan city of 2 million people. But what about Tokyo? 40 million people. Which one is a metropolis? Istanbul has 16 million, but Tokyo has 40 million. So the size, the scale. So, and 45 million people live in other cities around the world. They're called metropolis. And Shanghai, for example, is a place where 35 million people live, like Tokyo and Hong Kong. So the scales are being mixed up, and it's confusing. I mean, so we have to have a micro scale operation. Tailor-made approach is required. You can have a general format for everything, but it's like medication. You can't use one medication for all diseases. The physicians know it very well. I mean, people go to the doctor and they tell the doctor, this drug is very good. Can you prescribe it to me? No. And this is where the importance of local administrations come into play. You see the problems because we're close by the people. And people say, be aware when you're on the street. But when you go home, there's no one at home. So you don't pay attention, but 50% of transmission takes place at home, where people usually feel safe. So healthcare staff, they go to summer camp. They went to summer camps belonging to the municipality to get them ready for the second wave, so that they can rest there. This raises the morale, and this helps. And I visited the healthcare staff professionals from time to time in those camps. So organizing these morale-raising activities for healthcare professionals is important for resilient city. Instead of generalizing, I think you should look at the statistics, the data, and evaluate those in a sound manner. Panicking is damaging, and being optimistic helps. So thank you very much for your invaluable contributions. Your microphone is off.
Thank you very much, Mayor Tahir. The things you said were very important. I agree with you in terms of planning. Yes, we should have a basic master plan, but then we need to be flexible because the conditions are changing rapidly and we need to adapt quickly. But there is another critical issue. We also witnessed this when we went around Turkey for other projects. Data sharing is not very strong in Turkey, unfortunately. For example, when you go to the metropolitan municipalities or the district municipalities, I mean, the district municipality provides important service to the districts. And the list of people who require social aid or people with disabilities, it doesn't really exist in detail. And when you talk to them, apparently they are not able to get this data from the Turkish Statistical Institute or the ministry. So it's basically they receive this information based on referrals, based on their own relationships in the community. I would like to give some field information briefly. Our Metropolitan Municipality has undertaken all these protocols, and together with the Ministry of Health and the Family and Social Policies, we are having a data exchange. And our system is basically integrated with the population data infrastructure. But basically, when you first contact someone at a lower level, they say, no, we don't have it. But when you actually talk to someone from a more leadership group, you are able to access that data. And data mining, big data activities, it was mentioned, yes, there is a need for that. I agree with you on that. Thank you very much. Now, Mr. Kadir, from the same scope, in terms of being prepared for the upcoming periods, what needs to be done? Now, first of all, I would like to thank Professor Önder Ergönül for his invitation for collaboration and the information he has shared. Now, in the context of what was mentioned, if I need to create a ranking, first of all, we need to understand that such crises can occur in the future as well. And I believe that all local governments with their stakeholders need to receive some training about crisis management. So for potential crisis cases, planning, monitoring, and such activities need to be adopted so the process can be managed in a healthier manner. And secondly, the society adopted the lockdown announcements that were made. And I believe there can also be an educational mobilization created to increase the knowledge level of the public further. And also, psychological resilience needs to be increased, and also support for household economies is important. And I believe local governments and other actors also need to be able to make better utilization of digital tools. Remote education, for example, became very important throughout this process. And in terms of water and food saving, we need to provide better information, and we need to work from a governance perspective. So, in summary, without governance and communication, transformation and development cannot exist. I respectfully greet you all. So thank you very much, Mr. Kadir Albayrak. And finally, I would like to turn to you, Professor Önder, for being future-proof, for being prepared for such cases in the future. What are the requirements? I would like to thank both our mayors. It is very nice to see that both from the field and the academic side, the approach is quite similar. So we are thinking the same things, basically. And when we look at the past experiences from past pandemics, the WHO has sent us to many places, like Sri Lanka and other places. And one thing I've discovered is that, I guess it's in our genes, we are very easily responding to crises. We adapt very quickly, considering other countries. That is one thing I have noticed about Turkey. So that's a good thing, but there is something we are missing out on. Once it's over, we forget about everything that happened. I guess it's because we're very emotional culturally. So increasing outdoor spaces and things, that is very important, something to be remembered after the pandemic as well. And cities that are planned according to the needs of the citizens is very important, no matter what the population is. So human-focused activities is important, but we should leave this phase with some learnings, with some wins. And we experienced this, and when you look at it, we are not doing very bad compared to the rest of the world. And a lot of people have contributed to this. I mean, in terms of the measures taken, the ministry has contributed, the army of health professionals has a very important contribution. So we can set an example, and we need to make sure that we have some wins. And one thing is the academic world coming together with the field. I mean, the academic world shouldn't be perceived as people who are sitting in high towers and speaking a language that no one understands. No, we are able to create solutions to urban problems, about daily problems. But maybe we just think in a calmer manner. And after this pandemic, we should have some learnings in these areas. We are always here, and we can focus on how to develop our cities in a way that it will create healthier citizens and healthier cities as well. And maybe if we can create a brief report out of all this conversation we've had, that could be very beneficial as well. And I would like to thank our mayors for their positive approach, and I'd like to thank you for organizing this. I'm sorry, I keep forgetting to turn my microphone on. Thank you very much for participating and providing information. We will have a brief Q&A session if we have any questions from our attendees, and we will ask our mayors and Professor Önder to respond to these questions. Let me read one. There is one from Albania, from the Municipality Union of Albania. The question is about the role of municipalities in terms of schools and whether or not there was a budget allocated for this. And local governments aren't really very active in terms of schooling in Turkey, but maybe our mayors may want to respond. Well, the responsibility assigned to us by the law on municipalities is, I believe, 10% of our budget. If I'm wrong, please correct me. 10% of our budget is required to be allocated for school-related activities, but this is limited to the means the municipalities have. So we don't have direct responsibility in terms of building schools and things. It is based on the Ministry of National Education and the governorate. So if municipalities want to provide support, they do it as part of a protocol. But throughout the pandemic, we worked on meeting the requirements of schools in terms of disinfectants. And about online remote education, students had some internet and computer demands. We tried to meet those. For example, there are 27,000 students that are children of families who receive social aid. So we said we will meet all their expenses in terms of internet for remote education. So basically, we said we will provide support to the children of families receiving social aid. And there is also an issue that always comes up, the free rider issue, people who are after free things, basically. I am not talking as a politician here, I'm talking as an academician. But basically, implementations that encourage free riders in turn lead to not being able to meet essential needs in the future. For example, if I made the internet free for everyone, but I didn't build any roads, what would happen? So that would be populism on one hand, but then there will be vehicles waiting on the roads because the roads weren't built properly, and we will have emission problems because they are stuck in traffic for so long. So basically, there needs to be some sense, some rational basis in policies that are carried out. For example, we said that we will provide school-related internet support for 27,000 students because they are the ones that don't have the financial means required. Another question. Can I add just very briefly? Yes, of course. Now, in terms of education, I guess we could divide it into two. Pre-pandemic, during the pandemic, and post-pandemic support. So as the Tekirdağ Metropolitan Municipality, we built schools and handed them over to the Ministry of National Education, several schools. But then we started to receive some demands, just like my fellow mayor mentioned. I mean, it was something that we did as a favor, and then it was required from us. But basically, throughout this pandemic, all municipalities met the requirements coming from the schools in terms of masks and things. And before the schools were opened, we asked the Ministry of National Education for some support for all the material needed for schools, and they were prepared to help us. Another question is about whether or not the systems of the ministry and the municipality is integrated in terms of people who require social aid. Well, as I mentioned previously, our system is integrated with the Ministry of Family and Social Policies and also the Population Institution. So all our data is acquired online from the population database, the central population database, and we can see the aid provided by the Family and Social Policies Ministry there as well. The only thing we can't see is the district municipalities' contributions to social aid because they're not integrated to the system. So there is requirement for a software to be developed here in that sense, but in terms of municipality and the governor, yes, there is an integration, so we don't have repeated aid provided. How about on your side, Mr. Kadir Albayrak? Yes, I agree. And throughout the pandemic, as we were providing aid, we were always in contact with other public institutions and with the governorate, so we didn't have any repeated aid. Another question. There is an increase in household domestic violence throughout the pandemic. Did you observe this, and did you find solutions for it in your own area? Well, previously about other statistical issues, I made the same declaration. Now, as we are visiting the field, we basically see individual examples. So we can't really generalize it. So together with a lockdown throughout the pandemic, an increase in domestic violence. I haven't seen any statistical data about this. These could be some individual observations, and as a hypothesis, I can say I believe it may have increased, but I don't have any data related to this, and I haven't received any such studies from anyone. Through our 153 hotline, we had 2,840 psychosocial consultancy, psychological counseling services. And we could look at the details of those. Another question is, it seems like in the provinces, there are two boards. One is the provincial health boards, and one is the provincial public health and hygiene board. So throughout the pandemic, did they have differences, or did the two work in collaboration? Now, there's a lack of information here. The pandemic boards were led by the governor, and all other participants are attending these board meetings. And for a decision to be taken and implemented, there is a requirement for a law. And this law exists within the law on provincial public health and hygiene boards. So the decisions are taken based on the law on provincial public health and hygiene board and implemented. So these are not two different structures. It's just basically about the wording. Yes, same with us. We didn't have any problems either. It's just like what my fellow mayor said. We have an international question, and it is basically, did the COVID-19 pandemic improve the coordination between central and local governments in streamlining disaster risk management and disaster preparedness and prevention? In terms of Kocaeli, I can say that we didn't have any problems in this area, and especially in terms of health professionals, for example. I mean, in the hospitals, our health professional works, right? And then they go home, and then the children at home are at risk, or they may have elderly people at home. So to prevent them from transmitting the virus to the members of their households, we use the state dormitories as part of the protocol we signed with the governorate. So we allocated these dormitories for them, and their clothes were clean there, and they were served food. So we met all their needs there, and we worked together with our governorate and the related departments within the governorate and the municipality. So we worked in full coordination, and we didn't have any problems in Kocaeli, basically. And we have our 15 drivers, for example, allocated for these purposes. So can we reach the conclusion that
So it was quite coordinated, your efforts, your share of responsibilities was coordinated well. Yes, that's true. As far as I've seen or can see, there are no questions. Further questions. I'd like to thank the mayors, Önder Bey, and all participants, the Marmara Municipalities Union, for organizing this event. Thank you very much. Our goal was to raise awareness and to share our views and to improve our performance at the end of the day. And yes, there are good practices in our country as far as we can see, but sharing these good practices with the public is important to find out what the reality is. And thank you for sharing your experience in a transparent way with us. And we would like to continue cooperating with you on other occasions, because once we improve municipal governance, a life of quality will increase in cities, and metropolitan cities, they're actors of development, and they are active in many fields. So development will speed up as a result. Thank you very much for your contributions, for input. I'd like to leave the floor to Cemil Bey. Well, thank you very much, distinguished mayors. Thank you, distinguished professor. We have had many international participants to this event as well. And thank you very much to the mayors for sharing the experience for a few hours. And I mean, some international speakers, they they heard about the practices in the COVID period, and university, municipality, and NGO union of municipalities, they have a quite a good level of cooperation. Thank you very much to the academicians. Thank you very much to Önder Bey and the mayors. And I would like to extend my deepest regards to each and every one of you. Thank you for joining us. Goodbye.